Okay, so planning for healthcare retirement is one of the many components of retirement planning that we talk about. Now, we can't sell, Medicare plans. We can sell long-term care plans and service them, but we do know a lot about these different activities that are involved in retirement, and certainly in regards to healthcare. So we're going to touch probably at a very high level. We welcome your questions. If you have more questions at the end, I think we'll answer questions and probably create questions, which is fine. Feel free to email me, call me. There's all my contact information in case you don't have it. I'll leave this same slide up at the end of the presentation so you can write it down or take a screenshot, whatever. But certainly feel free to email or call if you have any questions. We also will offer a handout that summarizes some of the slides, but I would suggest if you need to repeat, just wait for the recording. That'll probably be out in about a week. You have to just send it up, get it approved, and put it back on the website. So that'll be available as well. And I'll repeat this at the end of the presentation too. So here we go. All right, so concerns, escalating healthcare, big concern. We'll see in another slide how quickly healthcare inflates compared to regular inflation. So it's something we certainly have to understand and prepare for. And then the other one is what is healthcare and retirement like? What are our options? What are our plans? What's the best way to navigate healthcare and retirement? So here's the inflation slide. Now, this is 2019 numbers. Since 1999, excuse me, last 2019, 1999, 2019, 2018, excuse me. You can see that the overall healthcare premiums have gone up 240%, whereas our earnings have only gone up about 68% and inflation 51%. Now that's different for this year, right? Because we already know inflation numbers were released today, 8.5% year over year. So those numbers would certainly be even more different than they are now. But the message is that healthcare premiums go up faster than our income does. So we need to try to overcome that with some additional savings. So this is what we see as a trend line. We expect them to grow. Like I said, this year is different. This year breaks the trend, but we do expect them to continue to grow in the future as well. Basically, two sectors of our economy grow higher than inflation: healthcare and higher education. I know that personally because my daughter is going to University of Maryland next year, and it is quite expensive, even for in-state. So I get to see that myself as well, which is exciting. Okay. Healthcare spending is going to increase. We talked about this all. So there's really two different groups or ages that we need to look at, 65 to 74. So more or less your first 10 years, you're the healthiest, you're the best you're going to be typically as far as health is concerned. So your out of pocket costs are fairly reasonable, but not much different than you would pay at the job as far as those costs are concerned. Now, this is just out of pocket. This isn't a premium, so we'll talk about that later. But what happens at 85 and older, we need more medical care for lots of reasons. So you can see that is a much higher percentage of your household expenses, 19%, close to 20%, whereas we were closer to 10% before. So it's understandable, but when you put it in numbers, it certainly helps you see what we're headed for. So how much will a couple need today? So this is a number based on 2019. So Putnam put this presentation together in the 2019 numbers. So this is the premiums. 65-year-old couple, present day dollars, how much it would cost them for Medicare premiums. So we'll get into that. Part B, D, and any Medigap policies. So that's just the premium side. That's just what you get to pay to keep the coverage, to have the coverage, to have the privilege of the care. Then you add the out-of-pocket costs, so deductibles, co-pays, etc. That 419 and 187 adds up to a whopping $606,000. So that is quite a number. Now we have life expectancies in these charts of age 87 for the male, as you can see in the small print, and 90 for female. So quite a number there that we need to prepare for. And this comes out of retirement. That's the only place these funds can come, unless we have excess income from pension, Social Security, et cetera. This is probably coming out of our IRAs, our Roth IRAs, investment accounts, cash, et cetera. Longevity. So now we're looking at, we were looking at a couple before. Now we're looking at a healthy male, 55 years old, will expect to have total costs. So we're talking premiums and out of pocket, about $437,000 for a healthy male. Okay, and that's living to the life expectancy of 87. Again, you can see that in the print below. The diabetic male, that shortens the lifespan about 10 years. The costs are less because of that shortened lifespan. Actually higher costs along the way, but shorter lifespans. That right now, those numbers for 2019 was 213,000. So the point is, longevity plays a role, and certainly we want to live as long and as healthy as we can. And this is just acknowledging that there's a cost associated with that. By the way, if you have a question or a chat, that you want to ask a question, be glad to try to help you with that anytime along the way. And Devin, my associate, is monitoring that, so he'll raise his hand at me if we have one of those questions. So otherwise, we'll take them all at the end. Okay. So here's a big change, which really changed the responsibility of healthcare and retirement from employer plans to individuals. Basically, the accounting rules were changed in 1990. And what it did is it forced companies to expense future costs of healthcare, bring it onto their balance sheet and their income statement. So obviously, companies didn't want that, didn't want to show those expenses that way. So basically, from 1990 forward, the amount of private pay or private employers who offered healthcare and retirement dropped significantly. So not sure what caused that. We don't really have information on it, but really that's the reason that very few private pay employers offer that. Sorry about that. Okay, so now we've kind of built a case for the cost of healthcare. So let's talk about some of the options. So some of the options, one that most comes to mind is Medicare, right? So Medicare is not necessarily a perfect plan. It's in 2008, began spending more benefits and tax received. About 60 million people were covered in 2019. Last 5 years, Medicare Part B costs have risen significantly, almost 7% a year. And then they're projected to grow about 8% in the next 5 years. So we are close to that period of time. Unfortunately, the trust fund is exhausted. Now, in the past, Congress has stepped in and fixed it. Hopefully that'll happen here with Medicare, and soon after it'll have to happen with Social Security as well. So we'll see what that means. It could mean a lot of things. It could mean raising the age. It could mean more premiums. It could mean more taxes for those that are working, et cetera. A lot of those are in play. We'll have to wait and see what that looks like. But right now, it's being exhausted fairly rapidly. Part of the reason, too, is they've added folks onto Medicare that wasn't designed to cover. So that's, impacted the trust fund, too. Okay. So we're going to talk more about Medicare, but I also want to talk about long-term care costs. So long-term care costs are not covered by Medicare. And right now you can see that a nursing facility, this is nationwide, it's about $105,000, home care, 55, adult daycare, just under 20. So there are significant costs that we need to have covered with private pay solutions. Again, Medicare only covers a few days in each of these scenarios. We have to have other ways to cover those services as we might need them. So just a summary of what we talked about. Certainly we have longevity that's playing a role. We're living longer, and that's great. That's a credit to our healthcare system. But there's a cost that goes associated with that. So we got to be mindful of that, how to manage it. It'll continue to decrease as we experience the tail end of the baby boomers retiring. Long-term care risk is uncertain. So what I mean is you may or may not need it, but if you do, it can be very expensive. It doesn't mean life's over by any means. It just means that there's an extra cost that we have to account for. And future retirees will have to rely more on personal savings to meet their needs. So we'll show you some of those ideas. Okay, so if you are a federal employee, you can add Medicare or not. If you're not a federal employee, then your only solution for healthcare and retirement is Medicare. So that's something you want to weigh, because I know I have some retired federal employees or soon to be retired federal employees. So that's just something to think about. Basically, the decision would be, does the extra cost in Medicare cover the gaps? I'm sorry, the extra cost in Medicare cover the gaps that the federal retirement plan doesn't include. Is it appropriate? Because you need to weigh the cost of the premiums versus the benefits and decide if that makes sense for you. Disabled folks are also included in Medicare, so they're not retired, but they have a disabled condition or health condition like end-stage renal disease. Okay, let's go deeper with Medicare. So Medicare Part A is covered for everybody that's paid into Medicare, basically if you've worked 10 years. Same qualifications, Social Security. There's no premium. That's a benefit that you get from the deductions you paid from payroll for your working lifetime. In general, it's covering hospital care. Okay. There's a deductible that would be required. There's a little bit of coverage for nursing home care. It's the first 20 days, if you're interested in that. A little bit of home health care, a little bit of nursing care. So that's why I said on the previous slide that you have some of that covered, but it's a very short period of time. It's designed to be a recovery coverage, and that if there was more time needed, then that would be out of pocket or private pay, like a long-term care policy. Part B is basically doctor's visits, outpatient care, preventive care. So this is the 2019 slide. So it says the premium is $148.50. It's actually $170 now this year. It goes up every year. And it's an 80-20 plan. So 80% of your coverage or costs are covered through Medicare. The other 20% is on you. The final part to most folks' Medicare solution is Part D, which is the drug plan. So that's prescription coverage that's offered by private pay companies. There's several different options, and that's something where you want to get with a Medicare expert, someone who sells that and services it, and have them look at what meds are you on and which solutions have the best coverage, and certainly that would be the one you'd want to pick. Medicare Part D drug plan may also come in a Medicare Advantage plan, which we'll talk about here in a little bit. But that's your basic coverage that you want to take. The only one that has no cost is Part A. Part B has a premium, and Part D has a premium associated with it. One of the things to keep in mind, and sometimes, a lot of times forgotten until you need the service, is Medicare does not cover dental care, does not cover eye care or glasses, dentures, any kind of cosmetic surgery, acupuncture, hearing aids, etc. So the dental and the eye care, hearing aids are usually pretty big eye openers for folks in Medicare. So, they're not expecting to have that gap in coverage. So just want to make sure I point that out to you. Okay. So this slide is a year old for Medicare purposes. So You can see the point. The point, though, is that there are, just like the tax code, there are premium rates depending on income. So there are tax rates depending on income, and here the premium rates go up depending on income. So right now, the rate for 2022 Medicare is $170. So that first line there says $148.50 is now $170.10. So if you're under $176,000 as a couple, your income, then that would be your payment. If you go over, then it's $207.90. Now this is even though it says a couple, that's per person. Okay, so if you're a couple under $176,000, your premium is $148.50 per person. But I just said that's the old number. It's actually $170.10 per person. One very important point is that the rates are based on 2 years old income tax returns. So for 2022 rates, it's based on your income tax return of 2020. So for example, if you have an expected income, like you're retiring and you're going to get, again, I know for federal employees, you get paid for sick leave and that sort of thing, that if you have the option of taking it 3 years before you turn 65, that might make sense. Or if you could spread it out over 2 years, 2 taxable years, that's something to think about too. But as long as it keeps it under your combined income under 176, then you should be in good shape. Check and see. Do we have any? Okay. Yeah, okay, just make sure we don't have any questions here. All right, but very important point is Medicare premiums are based on income tax return 2 years ago. So we're going to talk a little bit about doing a Roth conversion. So Roth conversion is income. So that's something you want to consider too. If you like the idea of a Roth conversion and you see value in that, again, we'd want to try to spread it over a couple taxable years if we can. We'll talk a little bit about that more. All right, enrolling in Medicare. So you have this 7-month period where you can enroll in Medicare. You have the 3 months before your birthday month, you have your birthday month, and you have the 3 months after. So you can see, depending on when you enroll during your initial enrollment period, will determine when Medicare actually starts for you. Then you also have the general enrollment period. So basically, if you missed your initial enrollment period for whatever reason, you would have to wait for the general enrollment period. And then if you have a special enrollment option, so that would apply to folks that are over 65 or were in an employer plan covered by group medical and employer plan, and a 20-person company or larger. And let's say you work till 67. Now you're retired, you come out of that plan, and then you have that 8-month where you can enroll, 8-month period where you can enroll into Medicare. Okay, I see question, what's life expectancy for healthy diabetic woman? I'll have Devin look that up for us, and then I'll get right back to you. All right, thank you for the question. Okay, so this is very important that you make sure you pay attention to this enrollment period. Because what happens if you miss your enrollment period and you don't have, you're not covered by an employer plan, it's a 10% permanent increase in your premium. Okay, that's not mentioned here. I think it's mentioned on another slide, but very, very important. Also, something that some folks don't realize, if you're contributing to an HSA, that has to stop when you are enrolled in Medicare. And so if you're doing that, I think it's a great way to save for retirement and or save for medical coverages, but that would stop. Now you can make payments for Medicare from your HSA account, but you can no longer contribute to an HSA account. That's the last bullet on the initial enrollment side. Okay. Other open enrollment periods. So you've noticed probably if you're watching TV from October to December that you get, depending on what channel you watch, you're going to get bombarded with Medicare open enrollment. Sign up for this plan. Give us a call, 800 number. That's what's happening. October 15th to December 7th, every year you have the option to change your Medicare Part D. Okay, so and change Medicare Advantage plans. So you be mindful of that and whether it makes sense to do that. So it could be very valid reasons. You're on a medication you weren't on before. So you certainly want to investigate, is there a cheaper, more effective plan? And that's what a Medicare agent insurance agent can help you with. You can change, if you're in Medicare Advantage, you can change. We'll talk more about that. And we'll also talk more about Medigap, how you can enroll in that in the last 6 months after you reach age 65. What does that mean? Medigap is basically fills in the holes not covered by Medicare Part B. So we'll talk about more about that. Late enrollment, so I mentioned that, I kind of jumped ahead. Applies as long as you're enrolled in Part B. Your monthly premium can go up to 10% for each 12-month period that you wait. So you don't want to miss that time. And if you do miss it, then you have that 7-month, you have the general enrollment period where you have to wait to sign up. So you have the initial enrollment period, that 3 months before your birthday month, and 3 months after initial enrollment period. If you miss that, you got to wait to the general enrollment period. You pay 10% more, and you have to wait for a couple more months potentially, depending on when your birthday was, to sign up. So don't want to miss that if that's part of your plan. The other thing to think about is that, let me go back, is that I've had this discussion with some federal employees, not sure if they want to sign up or not. So my general recommendation is sign up, and if you can't, determine if it's going to benefit you in that first year, sign up for a year and just see, and then compare and do your due diligence. If you weren't able to do that before, or if it was not available to you, or for whatever reason, but at least sign up and don't wait and get penalized. And then you can certainly decide over that course of the year, does it make sense? Is it cost effective for me? Is it providing enough benefit for the premium I'm paying to make it worth it? Or should I just stay on my retiree plan? So certainly wouldn't want you to pay extra, but it might take a few months, maybe a year, to figure out, does this make sense? Okay. So let's talk a little bit about Medicare Advantage. So if you have a Medicare Advantage plan options in the area, and I know there's a couple in Maryland, and last time I inquired, there's some pluses and minuses. Service, depends on what you need. But basically, Medicare Part C includes A and B together, and it's a private alternative. So it include all the components of A and B. Okay. The bonus is it also will include some on bullet 2, vision, dental, hearing, and maybe for some prescription coverage. So it may be that is a more viable plan than trying to buy Medicare B and, for physicians, and D for prescriptions. It may be that Medicare Advantage Part C is a better option. Now, depending on the service area, it might be an HMO framework or a PPO. So, I know different folks have different experiences with that and might want to check that out to see if that makes sense for them. Okay, so Medicare, so Part C can replace A and B, and certainly it's worth looking at if that's what you're thinking. Medigap policy covers the gaps that are in B. So remember, there's a 20% copay in B. There's deductibles for different things in D. So it's worth looking to see, is there a Medigap policy? So they range from A through N. The most popular Medigap policy that I see clients buy is F, because that seems to be the most comprehensive and the richest benefit for the dollar. So that's something that you might want to look at if you are considering Medicare. Now, just another, because I got some federal folks on here. Probably if you have the federal plan and you added Medicare B, maybe D, I seriously doubt you need the gap policy. Okay, so that's probably not a cost that you need to look at. But for the rest of us, want to add A and D for drug coverage, potentially look at Part C to combine A and B and D. And maybe that will work. Maybe that's sufficient. If you do choose Medicare B and D, then you probably want to look at a gap policy to see if that makes sense for whatever is not covered in B and D. Hope I didn't confuse you. Anyway, just another way to look at those same paths that we talked about. Okay, so you have A and B. B was Part A of Medicare was covered. That's your that's your doctor, that's your hospital coverage. That was covered through payroll deductions, no cost to you as long as you work 10 years. Part B, that's extra cost. Okay, so you can have that combination. If you do, then you want to add a Part D drug coverage probably. You probably are on meds and you want to, have some of that cost covered through insurance. And then you probably also want to look at a gap policy, which is going to cover a lot of the exclusions from Part B and Part D. Would it be worth looking at, though, to see if a Medicare Advantage plan is good for you, makes sense for you? Because that's going to combine A and B, parts of D, okay, and some deductibles and copays that weren't covered. So certainly worth looking at wherever area you're in to see if that makes sense. Okay, so let's talk about long-term care. So two pretty much solutions for healthcare and retirement is Medicare and then long-term care. All right, long-term care is something we can help you with. There are many, many ways to navigate long-term care. There's a traditional pay-as-you-go, which would be very similar to, say, homeowners insurance. You pay for a benefit that you may or may not need. If you do need it, there's coverage. If you don't need it, say you pass away before you need long-term care, there's no return of premium. There's hybrid coverages that would include life insurance and long-term care. So that's very attractive to folks because the dollars are going to go somewhere, either to you as a living benefit, to healthcare, or to a beneficiary, or a combination of those. There's asset-based long-term care where you say put down 50,000, 100,000, something like that, and you get a couple multiples of coverage, say 200,000 of coverage for that, and you never have to make up another payment. And we can also do it as an annuity rider. So I just said that to let you know that there are many, many ways to look at it, long-term care. So what is long-term care based on? Healthcare factors. It is, you do have to go through underwriting. There is an application, so you have to consider that. If you don't have long-term care, then a family friend or family member might have to step up and provide the care. Sometimes a spouse can for a little bit, but you got to remember, spouse is probably a similar age, so might not, have the strength or the energy to do that. And it's also a lot to ask, so you certainly want to think about that as well. But the third bullet, we walk you through all that. What's the right benefit for you? How does the elimination period work? Elimination period is basically your deductible. So we typically recommend 90 days. That is, the first 90 days you pay out of pocket, and then your insurance would kick in. There are different levels, there are different triggers, there are different inflation protection, et cetera, et cetera. So give us a call. It certainly makes sense because even with Medicare A, B, D, and gap policies, they still do not cover long-term care, extended long-term care, just a few days. So we want to talk with you about that if you're interested. Okay. So, okay. Question 2. All right, hold on. Let's see what we got. Okay. So this one I can answer, I think. Where does Tricare come in? So Tricare is going to be your coverage for the military. I think you'd have to ask, maybe I can't answer this question, Kurt. You probably want to talk to your HR folks about that, because it you want to work the coordination between Medicare and Tricare and see how that works together. So like I said before, probably there's sufficient care within Tricare that you you may not need or want to take on the extra cost of Medicare Part B. Probably don't need D. The drugs are probably included. But I would just, I'd recommend that you get with HR and have them help you through that. Worst case is I'd sign up for Part B just to make sure you don't miss out and have to pay an extra year, for missing it for the first year. You got to pay the 10% penalty, and just then work through the numbers that way. If you can't get the answers you need, or it's not working out, or it's not clear to you what's covered and not covered, that's what I would do. Now, I hate to see you spend those extra dollars, but otherwise, I would try to work through your HR folks and see how they could help you.
There's one more in the chat.
Yep. Okay. I'm confused between the difference between Part C, which includes A and B, and D. So what else covers? Okay. So let me just go back a slide. There we go. So just to hopefully clarify, because this can be really confusing. So original Medicare, again, Part A, your hospital, that was covered through your payroll deduction. Part B is something you have to sign up for if you want it. That's going to cover basically doctor's visit, preventative care. Okay, it does not include any drug coverage, so that's where you would add a Part D coverage. Where Medigap comes in is there are deductibles and copays and limits to the coverage of Part B and Part D. So Medigap would come in and fill a lot of those holes. That's why they call it a gap. It's filling in the gaps left by Part D, B, and D. So you have that option, or you could go with Part C. So Medicare Advantage Part C includes Part A, Part B, and usually, as it says there in the underline, Part D, drug coverage. Okay. So you just want to investigate that plan that's in your area, because it has to be one in your area. They're all geographic, and see, does that work for you? Is that enough coverage to be feasible for you? Does it include the doctors you need to include? Does it include the meds that you're on sufficiently that it makes sense? It could be very cost efficient, because like I said before, the other thing at Medicare Advantage includes is some hearing, some vision, and dental. Okay? So you just want to investigate the one, but basically Part C is a combination of A, B, and D. Hope that helps. All right. Okay. Do you know what lines on your tax forms do Social Security use to decide how much your So the question is, do you know what lines on your tax forms the Social Security use to decide how much to pay per month for your premium? Yeah, basically it's your AGI. So you look at your adjusted gross income. So what's adjusted gross income? It's going to be any pension income. It's going to be any pre-tax IRA distributions. It's going to be not disability income, pension, Social Security, and IRA distributions. Now, most folks are going to end up being taxed on 85% of your Social Security. There's two forms of taxation, 50% of your Social Security and 85% depending on your income, but the threshold is really low. So just assume you're going to be taxed on 85% of your Social Security. And then that's netted. So you take your gross Social Security, 85% of your Social Security, take your pensions, take any IRA distributions, deduct your whatever deductions you have, equities, your home equity, home interest, mortgage, your charitable contributions, anything like that. And then you have your AGI. Basically, just going to look at your AGI, adjusted gross income. So let's say you decide to retire early. And by the way, if it wasn't clear enough on any of those answers or questions, feel free to just give me a call or send me an email. I'm glad to go a little bit deeper or more specific to you. So let's say you decide to retire early. You're not 65, either medically or you're just ready to retire. You're feeling good about your finances. We've chatted. You know, you're in good shape there. The option would be Cobra. You know, so you have 18 months of healthcare coverage you can take from the time you stop working till you're 65. So maybe you stop at 63 and a half, and certainly you can get coverage that way. Now it's very expensive because basically you're paying the full amount. Remember, when you're employed, your employer chips in, I don't know, a third to a half, something like that. So the full premium will be on your dime if you do it that way. A lot of folks will use their spouse's plan. Maybe the spouse is retiring a little bit later. And certainly you can go out to the ACA exchange and buy it in the marketplace, public marketplace. And then sometimes there's some specialty coverage, but they're only going to be catastrophic. So you want to keep in mind that that's only going to be if you have like a $10,000 out of pocket or something like that. So I would not recommend that option because all kinds of things can happen pre-retirement. It's just, it would be better to try one of the first three options, Cobra. I like the spouse the best because all the spouse is going to do is change from an individual coverage to a family coverage, most likely. That's the best one if you can make that work, or otherwise use the marketplace. Okay, so this is where I was going to talk a little bit about the Roth, some smart tax strategies. We're going to have a presentation about the Roth in Roth conversions in next month. I'm sorry, next webinar in July. Really love talking about that because the more money we can convert to tax-free money, a lot of things happen. The lower our Medicare premiums, the lower amount of Social Security's tax potentially, and the smaller our required minimum distributions would be at age 70. So I'd love to chat about that. And then certainly this is a plug for that, that webinar. So using Roth to create tax-free income or converting from IRAs to create larger Roths. Healthcare savings account, max those out while you're working. Don't use them. Use your flexible spending account to cover deductibles and copays. Let the healthcare savings account grow year over year over year, max it out. If you have a employer that matches some of that, that's even better. Healthcare expenses when planning for income and retirement. Match income streams to fund the retirement care expenses. So some things you can do, you can use, when you look at your income, healthcare expenses, match it against your pension. You have Social Security, potentially you have Social Security and pension, hopefully. And if you still have a gap, if you're still not paying those fixed costs, one of the things you can do is convert part of your assets into an annuity. It's another way to do it. And so ideally, we sit down with a client, we really want you to be able to match guaranteed income streams with your basic costs, food, shelter, clothing, transportation. So pension, Social Security, and potentially an annuity, that combination of income, we know we have that coming in and it matches our fixed costs. That's just a real comfortable place to be. And then all the other savings we have, i.e. retirement in IRAs, Roth IRAs, et cetera, that can be used for other things, travel, replacing the car, fixing up the house, home modification, et cetera, et cetera. Okay. Certainly want to maintain emergency health care fund and consider delaying Social Security. That's another way to increase, because every year you wait past your Social Security. We talked about this in the previous webinar. Every year you delay past your full retirement age, you get an 8% increase. Really helpful in building that Social Security check. All right. Well, hey, I really appreciate you guys joining us. Thank you for sharing your time.